I love that we are in a scenario in triple-negative breast cancer now where we actually have options to be able to individualize based on toxicity profile and practical considerations, right? In terms of, is there access to ophthalmology or optometry, right, for Dato-DXd, and whether somebody's willing to do the prophylaxis. So this is really shared decision-making with our patients, and I think that's a better place to be with TNBC. I have to ask you, going back to trial design, we were talking a little bit about overall survival, and we've seen some initial results with regard to PFS2 for the ASCENT trials, for ASCENT 03 and 04, and we'll hear more about that at this ASCO. But Joyce, tell us how you think about what is PFS2, how do you think about PFS2, and is it helpful in this setting?
I do think it is. PFS2, it is adding together the duration of progression-free survival on the first-line therapy plus your second-line therapy, whatever that is. And you can, and on ASCENT 03 and 04, it was done, and we'll see updated data here at ASCO, as you said. And so the question is, would the PFS2 be the same if you got sacituzumab first line and then you got a taxane second line versus the other way around? Taxane first line, and then you get your SG. Maybe the PFS2 adding them together is the same, so it doesn't really matter. But that's not the case. It's longer. It's about 3, 4, 5 months longer with the PFS2 if you start with the best drug first. It's kind of what goes back to what we were talking about before, which is the attrition. The patient's either dying, not being well enough to get any therapy, or having such a diminished performance status by the time they get to second line that they don't get the same degree of benefit from SG that they get the first line. So, because that matters. Your performance status matters a lot in terms of your ability to respond to therapy and your duration of therapy and ability to tolerate toxicity and stay on therapy. So PFS2, I think it is a clinically meaningful endpoint to me.
That's very helpful. Ana, what are your thoughts about PFS2? Do you look at that?
So I fully agree with everything that Joyce just said. I think that many of these analyses are done as an exploratory analysis or as a secondary endpoint as part of the study. And with antibody drug conjugates and other therapies that may have overall survival advantage in later lines, and it being crucial to understand the impact also of sequencing of therapies, it would be nice as we think about the next generation of therapies in the first line setting and clinical trial design to power studies to be able to significantly demonstrate benefits also in PFS2 as we think about the right endpoints, right, to study these new therapies as we try to move them into earlier lines.